What is gout?
Gout is a form of arthritis that is extremely painful. Some say it's the most painful arthritis that there is. But it's a result of a substance called uric acid that basically falls out into the joints. Like if you try to dissolve too much sugar in iced tea, same thing happens with uric acid in the joints. And then the body tries to chew it up and get rid of it, and in the process releases substances that cause heat, swelling, redness, and most of all, pain.
Who's at risk and how is it diagnosed?
Well, as with most arthritic conditions, there is a genetic predisposition. You can inherit a tendency towards this disease. But because it's elevated uric acid, there are some things that can elevate your uric acid in terms of the types of foods that you eat, and even if you drink too much alcoholic beverages. So those are just some of the at least dietary risk factors. But in order to make the diagnosis of gout, the gold standard is to take fluid out of the joint and look at it under the microscope and see those crystals, those uric acid crystals. And if we can see those, and you've got pain and swelling, and eventually maybe an elevated uric acid, not necessarily when we do the diagnosis, that's gout until proven otherwise.
What are the treatment options?
Well, it's possible to have one acute attack of gout and never have another one. So oftentimes we don't treat the first time around. We'll give someone the drugs known as nonsteroidal anti-inflammatories. But if these attacks keep occurring, then it's very important to lower the uric acid in the blood, because that's the only way we can stop those attacks. And there are medications out there that lower the uric acid. It can take up to a year before the attacks start going away. But you're feeling great and your doctor has put you on a medicine. Many times gout patients stop taking their medicine because they feel good. And the thing that reminds them is that next gout attack. Don't wait for the next gout attack. Listen to your doctor and take the medication.
What lifestyle changes can help you feel your best?
Well, we know dietary restrictions in some cases are necessary. Certainly alcohol, drinking too much beer is probably one of the things that can raise your uric acid. You also want to cut down on foods that can raise your uric acid, such as shellfish and organ meats. The nice thing is once you're on medication, you can probably eat a few of those things and not have to worry about it. But something about gout that's a little bit different, it tends to be associated with some other bad players, such as diabetes, hypertension, obesity, and heart disease. So it's extremely important for patients with gout, I think, to have a primary care physician that makes sure that their pressure, their sugar, and their other risk factors for heart disease don't come into play. And that will keep you living the longest and the healthiest that you can with gout.